My dear viewers, we have Dr. Sridevi with us. Today, let's learn the importance of vitamin D from Dr. Sridevi. Over to Dr. Sridevi.
Thank you. So, as we know, vitamin D is a vitamin, but the problem is mainly it's got from the sun, due to sun exposure. Now, since most of us are more prone to sedentary life, we are not exposed to the sun. Many of us may have vitamin D deficiency, which can cause a lot of problems. So, vitamin D can be got mainly is through the sun, and also a few sources of vitamin D and through supplements. Now, coming to the benefits, why do we need vitamin D? Vitamin D mainly is needed for the absorption of calcium. As we all know, calcium is needed for the bones, joints and for the teeth. So, only when there is vitamin D, it helps in the absorption of calcium. So, indirectly, vitamin D is needed for healthy bones. Then also, vitamin D gives us a lot of immunity. So, when it comes to immunity, then we are not prone for any infection. The chances of infections become lesser when we have adequate vitamin D. And also for the cardiovascular system, and it helps in the diabetic control. It can, along with insulin, it can help us to have a better control in diabetes. And it especially helps us to have a very good mood. Mood increases, you feel very happy, and it helps in all the other systems, for example the cardiovascular system. So these are the benefits of vitamin D. So what happens is, now because there is a deficiency, so how do you know what symptoms do they have? They usually feel very weak, they get tired easily, there's easy fatigability, they will have bone and joint pain, some people can have muscle pain, they feel depressed, they don't feel like doing any work. So these are a few symptoms of vitamin D deficiency. So when you suspect vitamin D deficiency, they'll have a chronic pain. So you give a vitamin D test, and if the vitamin D is low, you can take supplements. Supplements in the form of, sometimes depending on the level of vitamin D, you can take it as a daily or an alternate day tablet, especially given in pregnancy. There's no problem, you can take it in pregnancy. And also sometimes you give for usual normal deficiency, that's when the demand is not high, then you can give a weekly tablet, that's about 60,000 international units. And also there are injections where it's given intramuscularly depending on the severity of the vitamin D deficiency. And this vitamin D should be corrected, because only when the vitamin D is corrected, the chance of infection, immunity, the mood, the overall well-being and health increases. So this is about vitamin D.
Yeah, very nice. Nowadays they strongly recommend, along with iron, folic acid and vitamin D also for a pregnant woman. And for everybody you should take, and for sun exposure.
And most importantly, breast milk doesn't contain vitamin D. That's the only thing that the breast milk does not contain. So along with breast milk, for the first 6 months, the pediatrician will advise also vitamin D, because it's very important for the bones. Otherwise, there might be softening of the bones. We call that as rickets or osteomalacia in children.
Yes.
So in children, it's very, very important, because that's when the bones actually grow. So vitamin D is given along with breast milk.
Yeah, we are really thankful for the great information. It's highly motivating, Doctor. Thank you very much.
Thank you.